Hi everybody, thanks for joining us. I hope you're enjoying this beautiful day. Just make sure to check out our website so you can enter the contest to win. The winner is going to be a Sabatino's gift certificate.
That's exactly right.
Tonight, Joan's going to be talking about pre-diabetes.
Yes,
it's a
we
great
are.
subject.
Here we go. She didn't want to say anything,
No.
by the way, okay?
No.
That was just all. She just had to talk.
Just off the top.
Anyway, so what is
Hi,
prediabetes all about? Prediabetes just means that your blood sugar level has not reached that of type 2 diabetes, but it's higher than normal. Without lifestyle changes, people with prediabetes are very likely to progress to type 2 diabetes. If you have prediabetes, the long-term damage to your blood vessel walls, to your kidneys, may already be starting, and that includes your heart as well. There is good news, though. Not everyone who has prediabetes progresses on to type 2 diabetes. There's things that you can change. Remember those things we talked about before? Lifestyle modifications, eating healthy foods, increasing your daily exercise, maintaining a normal body weight can bring your sugar level down into the normal range. Prediabetes, boy, I can't talk tonight. Prediabetes can affect adults and children the same. The treatment is the same, okay? Prediabetes generally has no signs or symptoms. However, there's one that you can watch out for, and that's darkened skin in areas like the neck, the armpits, the elbows, the knees, and the knuckles.
I did not know about that.
I know, you said
Yeah,
that yesterday.
yeah.
You said that yesterday.
Yep, I learned something
When
new.
we practiced this.
Yes,
No, we
yeah.
didn't. We haven't had time.
Hi, Angela.
So anyway, we don't know the exact cause of prediabetes, but family history and genetics certainly play a role in developing it. Inactivity, excessive abdominal fat are all important factors for increasing your risk for prediabetes. What we do know about prediabetes is that the body can no longer handle sugar or manufacture or to take care of the sugar in the body the way that it's supposed to. As a result, the sugar accumulates in the bloodstream instead of going into the cells. Risk factors for that, again, is weight is the primary risk factor.
It's always.
Waist size of over 35 for female and over 40 in a male. Dietary habits like eating red meat, processed foods, and sugary beverages. Inactivity. Age. Anybody can develop prediabetes, like I said before. However, over 45, you're at greater risk. Gestational diabetes. If you develop diabetes while you're pregnant, or if you deliver a baby that's over 9 pounds, put you at risk for prediabetes and diabetes. Also, sleep pattern. People who have sleep apnea, people who work overnight shifts or change shifts frequently are more at risk for prediabetes. Other conditions like high blood pressure, high cholesterol, low HDL, the healthy cholesterol, remember the dump trucks, and the high triglycerides. All of these things put you at risk, but this is not an all-inclusive list. There's many more things. The most serious side effect or consequences to prediabetes is developing type 2 diabetes. There's certain tests that we check all the time to check your insulin or to check your sugar levels. And the first one is called a hemoglobin A1C. This looks at how much sugar is in your bloodstream over a 2 to 3 month period of time. So it doesn't tell us that sugar that we test in the office right at that point in time. It looks for an overall sugar. So for that test, what we like to see is a hemoglobin A1C of 5.7% or below. Between 5.7 or 6.4 is called prediabetes. We also look at a fasting blood sugar. That means that you haven't had anything to eat for an 8-hour period of time. An overnight fast is the best. A fasting blood sugar under 100 is considered normal. However, we already know that at 85, you're starting to show impairment. A blood sugar level, fasting blood sugar that is, of 100 to 125 is considered pre-diabetic and also called impaired glucose.
Joan, remember years ago they used to say 80 to 120?
Yeah.
Now they brought it down.
Right. And you know what, Susie, you bring up a good point because people say, you people just want to make us diabetic. You've changed the numbers. No, we want to get you before you're a diabetic. That's why those numbers change.
Okay.
Good point, though.
Yeah.
Sue. Yep. So anyway, we're going to talk more on Friday about diabetes, okay? And hopefully I'll be able to talk better. Today it's just been crazy in here. But anyway, the other day I was in here working and I heard this message and I just wanted to share it with you because we're all experiencing anxious times at this point. But this saying really hit home for me. Anxiety is like a rocking chair. It keeps you moving. It just won't get you anywhere. Ponder that for tonight.
I like that.
All
That's a
right,
good one.
everyone.
Hey, thanks everybody for joining us.
Yep. Send in questions if you want
yes.
us to answer. And on Friday, we'll be glad to talk a little bit more in depth about this.
And don't forget to enter the contest.
Yep.
It's a good prize. Joan and I might even show up with yours.
Oh, there you go. Have a good one, everyone.
Bye-bye.
Bye.